Hello, my name is Brady Kirkman, Executive Director of Marketing and Business Development here at Windom Area Health, and welcome to The Pulse. With me today, I have Lori Fett joining us. Hello, Lori. How are you?
Hello, Brady.
Fabulous. So, first time on The Pulse, is that correct?
Correct.
Well, we'll have to make sure we get you on here recurring. So, talk to me a little bit about what your role and roles, for I understand, here at Windom Area Health are.
Currently, I started working at Windom Area Health 3 years ago in the Wooley Center. And since I've done some background in urology in my past as a nurse practitioner, I recently started doing some urology here at Windom Area Health as well.
And we're really expanding that urology department, aren't we? I mean, that service line.
Correct. Yep. Now that we've welcomed Dr. Stormont onto the team, we have a full urology line here available.
Well, and correct me if I'm wrong, it's hard to get that specialty service in rural communities. And, it's hard to get into those when you have to travel to larger cities as well. Would that be a fair assessment?
Yes, that's very true. It's definitely a need in the area. There's reoccurring needs that come into urology with certain diagnoses, that certain things like kidney stones that keep coming back. And a lot of people don't want to travel. So it's really nice to have someone local to kind of help with that barrier.
So, you talked a little bit about some of your background, and, we have a new urologist, Dr. Stormont. Talk to us a little bit about what your role is as a nurse practitioner in your experience, please.
So my role as a nurse practitioner is kind of bridging that gap. I'm able to hopefully get some patients in sooner, help them get set up for certain procedures that Dr. Stormont may need to do, such as maybe cystoscopies or surgeries, doing some pre-op, just to speed up their timeline to hopefully help them have better outcomes, help them reduce their pain if they're having a kidney stone. So, the goal is to help people feel better as soon as we can. Well,
and with most health care situations, this time is of the essence as well. And so, you use the term bridging that gap. They get to know you, obviously, then you're able to work collaboratively with Dr. Stormont as well. Tell me a little bit about how you think this service and how our approach is different than maybe some of our other partners around the community or around the region.
I think our approach here at Windom Area Health is different, that I feel like everyone here genuinely cares about their patients. They build closer relationships here. It's a community-driven hospital here. So I see a lot of support from the providers and a lot of care that they give to their patients.
So if you had to reach out to your patients and some signs or symptoms that maybe they need to seek you or Dr. Stormont's services, what would be those?
Signs or symptoms. So certain signs or symptoms for urology that would alert us to having you reach out would be blood in the urine. That's always a concern that we want to evaluate in urology. Pain in the kidneys, certain abdominal pains could potentially be a sign of kidney stones or related to urology. Urinary leakage, incontinence, erectile dysfunction is another area that we focus on in urology as well.
And these are all very sensitive topics, for an individual, but they're pretty common as well. Would you agree?
They're very common. Unfortunately, in the area of urology, is a lot of people are embarrassed. Mm-hmm. They don't want to come forward because they fear, being embarrassed by telling us what's going on. These are very common things. It's just a lot of people, they isolate those diagnoses.
How do you work with patients to really get past that concern or that embarrassment?
My goal is to be, approach it non-judgmental, being approachable, being there for the patient. It's a very sensitive subject to discuss, and letting them know they're not alone. There's a lot of people that deal with these concerns, and we want to be there to help them.
Absolutely. If they need to get a hold of you, how can they reach you?
You can reach us at Windom Area Health at the specialty clinic, and our phone number is 507-831-2400.
Well, thank you for joining us, and remember, your health is here.